Hospitals in our area continue to struggle with staffing levels and a crush of COVID patients. Daniel Hamburg is in the newsroom with how two local healthcare systems are handling it right now. Daniel.
Well, Valerie, I spoke with hospital leaders at Penn State Health and WellSpan Health. As we know, WellSpan got help this week from a federal emergency medical team and says that's already helping tremendously. Across its 8 hospitals, WellSpan is caring for 450 COVID patients, a number that's doubled over the last 6 weeks.
Our hospitals are operating above and beyond their intended capacity, and it requires taking certain areas of our hospitals, such as pre-op or post-operative bays or emergency department bays, and using them as space for hospital patients.
Since Monday, a team of 20 physicians, nurses, and respiratory specialists from the Air Force have been working alongside WellSpan employees.
While they're based in New York, the FEMA team gives us the capacity to shift other team members and resources across our health system and reduce the strain on some of our other hospitals and care teams.
It couldn't come at a better time when COVID is stretching the entire healthcare system to its limits.
We have a total of almost 1,200 patients. About 40% of those are there because of COVID-19, not because they have a different problem and just happen to test positive.
Penn State Health has a bit less, but that doesn't make things any easier.
20% of our patient population is COVID, but it's taken up 80% of our resources and energy.
Penn State Health was one of the hospitals considered for a federal emergency team.
I walked through the ICU units this morning. We have about 33 COVID ICU patients, and all of them are unvaccinated at this point.
Now leaders from both systems are begging the public to get vaccinated and follow CDC health recommendations.
This is not what we've seen before. This is a total new concept as we're pulling all of these pieces together. And we really do need your help as we get out of this.
The medical response team at WellSpan York Hospital is only scheduled to be there for 30 days, but the lieutenant colonel in charge says they'll reevaluate things in about a week and a half. In the newsroom, Daniel Hamburg, ABC 27 News.
All right, Daniel, thank you. And